early heart disease signs in women. Don't ignore these subtle signals from your heart. Welcome to the U.S. Health Guide. When we talk about heart disease, we often picture men experiencing severe chest pain. But did you know that cardiovascular disease is actually the leading cause of death in women globally? Alarmingly, in Vietnam, approximately 200,000 deaths occur annually due to cardiovascular diseases, accounting for about 33% of total deaths. What's more, heart disease signs in women are often very different, subtle, and easily overlooked, making early diagnosis and treatment more challenging than ever. This video will help you identify the subtle signals your heart might be sending, understand specific risk factors, and know when to act immediately to protect your heart. Let's dive in. A woman's heart often speaks in its own unique ways, not as overtly as what we typically see in movies. Instead of the classic crushing chest pain, you might experience vague discomforts that are easily mistaken for stress or ordinary fatigue. First is unusual fatigue and exhaustion. This isn't just feeling tired after a long day. It's a prolonged, unexplained exhaustion, even after adequate rest. A weakened heart struggles to pump enough blood and oxygen, leaving your body constantly drained of energy. Next is shortness of breath or breathlessness. You might feel breathless even at rest, during light activities like walking, climbing stairs, or especially when lying down. This indicates that your heart is having difficulty pumping blood effectively, leading to fluid buildup in the lungs or lack of oxygen. And here's the most crucial point: unusual chest pain. In women, a heart attack doesn't necessarily manifest as severe, crushing pain. It might simply be a feeling of pressure, tightness, dull discomfort, or heaviness in the chest. Notably, the pain can radiate to other areas like the neck, jaw, throat, back, especially the upper back or upper abdomen. In some cases, women experience a heart attack with absolutely no chest pain at all. Furthermore, don't overlook symptoms like nausea, indigestion, or abdominal bloating, symptoms often mistaken for common digestive issues, or dizziness, lightheadedness, or faintness, sometimes accompanied by excessive sweating, which could be signs of an arrhythmia or heart failure. A feeling of palpitations or a racing heart, your heart beating fast, hard, or irregularly, is also a warning sign. Finally, unusual cold sweats not due to heat or exertion, prolonged sleep disturbances, and swelling in the legs, feet, or ankles are also signals your heart might be trying to send you. Beyond common risk factors like smoking, obesity, and high blood pressure, women also face unique burdens related to specific physiological stages in their lives. First is age and menopause. As women enter perimenopause and menopause, estrogen levels significantly decline. Estrogen plays a protective role in the cardiovascular system, helping regulate cholesterol and maintain blood vessel elasticity. When estrogen decreases, the risk of atherosclerosis and high cholesterol markedly increases, explaining why the risk of heart disease in women surges after menopause. Second are pregnancy complications. Pregnancy can be a stress test for the cardiovascular system. Women who have experienced preeclampsia have a four-fold higher risk of developing high blood pressure and heart failure later in life, and double the risk of heart disease, stroke, or cardiovascular death. Gestational diabetes also increases the risk of developing type 2 diabetes in the future, a major risk factor for heart disease. Even premature birth doubles the risk of cardiovascular disease and coronary heart disease mortality later in the mother's life. Additionally, underlying conditions such as diabetes, high blood pressure, high cholesterol levels, overweight, obesity, along with a sedentary lifestyle, unhealthy diet, chronic stress, and a family history of early heart disease all contribute to an increased risk of cardiovascular disease in women. Recognizing early signs is crucial, but some symptoms demand immediate emergency medical attention without delay. Call for emergency help immediately if you experience severe or persistent chest pain/discomfort, a feeling of crushing, heavy, or intense chest pain that doesn't subside, especially if it radiates to other areas like the neck, jaw, back, or arms. Sudden and severe shortness of breath, feeling suddenly and intensely breathless, or difficulty breathing when lying down, having to sit up to breathe, or experiencing nocturnal breathlessness. Sudden fainting or lightheadedness, especially when accompanied by other symptoms like cold sweats, shortness of breath, or nausea. Abnormally fast or slow heart rate with symptoms. If your heart rate consistently exceeds 100 beats per minute or drops below 60 beats per minute, especially below 40 BPM at rest, and is accompanied by symptoms like shortness of breath, chest pain, dizziness, lightheadedness, or fainting. Unexplained cold sweats, especially when accompanied by other symptoms like chest pain or shortness of breath. Nausea, vomiting accompanied by chest pain or discomfort. This combination of symptoms is particularly important to note in women and should not be mistaken for simple digestive issues. Never ignore unusual symptoms, especially if you have known risk factors. Delaying action can lead to dangerous, life-threatening complications. Prevention is better than cure. A healthy lifestyle is the strongest foundation for protecting your heart. Start with a scientific diet. Prioritize fiber-rich foods like green vegetables, whole grains, fresh fruits, omega-3 rich fatty fish, and nuts. Minimize saturated fats, trans fats, sodium, salt, added sugars, and processed foods. Next is regular physical activity. The American Heart Association, AHA, recommends at least 150 minutes of moderate intensity exercise per week, or source of vigorous intensity. Exercise strengthens your heart's pumping ability, improves blood circulation, and helps control weight and blood pressure. Don't forget to maintain a healthy weight. Overweight and obesity, especially excess abdominal fat, are high risk factors for heart disease. Quit smoking and limit alcohol. Smoking, including secondhand smoke, doubles the risk of heart attack and is a major cause of atherosclerosis. Limit alcohol consumption as recommended. No more than 1 drink per day for women, to avoid increasing blood pressure and damaging heart muscle. Finally, learn to manage stress. Chronic stress can negatively impact cardiovascular health. Methods like meditation, yoga, deep breathing, and relaxing walks can help improve heart health by reducing strain on the circulatory system. And remember to get regular health checkups to monitor your blood pressure, blood sugar, cholesterol levels, and weight. Cardiovascular disease is a serious threat to women, but understanding the atypical signs and gender-specific risk factors will empower each of us to be more proactive in prevention and early intervention. Listen to your body. Don't ignore any unusual signals, no matter how small. Please share this vital information with the women in your life, your mothers, sisters, and friends. Together, we can raise awareness and protect women's hearts. Prioritize your heart health, because a healthy heart is the foundation for a full and happy life. Thank you for watching the US Health Guide. Don't forget to like, share, and subscribe to our channel for more useful health information.